Hello, I'm Jim Demlin with Clark County Close-Up. Thank you for meeting with us.
Thank you for inviting me.
Okay, let's get started with some background information first. What's the role of Medicaid?
So the Medicaid is basically, it's an insurance plan now, and it's in Washington, it's called Apple Health Medicaid. And the federal government basically funds it and has contracts with the state. And the states have to come up with a plan for how they're going to spend the program. They're responsible to administer and oversee the program. And then they kind of subcontract it down to various public, private, nonprofit entities to actually deliver the services. But the Medicaid program pretty much is an insurance health plan for low-income individuals.
Okay, and about how many people in Clark County receive Medicaid?
It's a little less than 123,000. The actual number is about 122,680. So about a fourth of our population are on Medicaid as of October.
Wow, okay. Any kind of general demographics of people receiving Medicaid?
You know, so pretty much because it is an insurance plan for the most part and pays for a lot of healthcare services and some supportive services, pretty much the main criteria is that you do have to be low income, and there's some income guidelines that the state has in place. And then you also do, you can't have any other kind of private insurance or Medicare unless there's special circumstances. So like if you are in foster care and you're adopted, or if you're on Medicare and low income, you can be dual eligible. But Medicaid's a payer of last resort. And you do have to be a U.S. citizen or be in the country legally.
And we're talking all age groups?
All age groups.
Okay. So let's get to the topic. What is the concept of Medicaid integration?
So back in 2014, the legislature and the governor approved a legislative bill called 6312, Senate Bill 6312. And basically what that was is they determined that they need to focus on whole person health. So focus on having healthier communities, improving individual care, and reducing costs. And at that time, the Medicaid system was broken out into 4 different systems. And so they basically determined by January 1st of 2020, they need to integrate the finances and the programs for that healthcare system into one. And so basically, it's meant to provide integrated, coordinated care for people with medical and behavioral health issues so that people can actually receive access to care in a more timely fashion and hopefully become healthier and reduce costs.
Okay, and so what were the 4 areas?
So it was chemical dependency, the outpatient and inpatient, so those were 2 separate systems. It was mental health and then also medical care.
Okay, so from the individual, let's just focus on that. From the individual perspective, so I'm on Medicaid, what kind of difference can this mean to me?
So basically what it means is you are assigned one health plan, and basically that health plan is responsible for all of your care. So you're assigned a care coordinator if you need one. So if you have multiple health issues and diagnoses, they can get you a care coordinator. They are responsible to assign you a primary care physician. If you don't have one, then you would contact your health plan and they will help you get one. They are also, if you need any kind of specialty care, they are responsible to help you get connected to that specialty care. Where previously to April 1st, you had to kind of do that on your own. You had to figure those systems out yourself.
So you mentioned, let's say if I'm a patient that's got some chemical dependency, caused probably from some mental behavioral health issues, and plus I'm getting diabetes.
Yes.
You're saying before you had to go to 3 different providers to get this. And
you had to go through these 3 separate systems with different eligibility criteria managed by 3 different entities. And so basically your doctor would deal with diabetes, but not necessarily your mental health or drug and alcohol. And then you had to go through another system to get access to mental health, which was a separate system. And then if drug and alcohol, that tended to be a ration system. So sometimes you could get into care if there were enough providers, but other times you were put on waiting lists. And after April 1st, the reason why we went to this is so that we could remove those barriers for people.
And those different providers weren't talking to one another?
No, they were not coordinating care. There was lots of issues with sharing data. They didn't even know a lot of times about each other, the different systems. And so if the providers aren't talking to it and the person was trying to get access to care, a lot of times they were just falling through the cracks.
Okay. Now, you mentioned the state was by 2020, but Clark County decided to go early, be an early integrator.
Yes.
Why did the county make that decision?
You know, one is we wanted to be able to kind of remove some of these barriers. We were seeing what these barriers were, and people were actually ending up in the jails, and they were ending up in the emergency rooms. And we just realized that that's costing our systems a lot of money, and a lot of these people had behavioral health issues, they were having severe medical problems, And we just determined that this is probably a better way that we need to approach this. We need to think about coordinating integrated care. So that was one of the reasons, was to improve the care for the people, the most vulnerable people. And then the other thing is we wanted to influence. We wanted to really shape how this. And so if you were an early adopter region, meaning you were the one to go first, you got a chance to work with the state to actually shape how policies and how contracts were developed, and really had some say in how this was to be implemented. So that was one of the main drivers, is we wanted to make sure we were able to shape this.
And it's not just Clark County.
It's Clark County and Skamania are in the same region, in Southwest Washington region.
Wow, so that was a big jump.
Yeah.
So what's your experience been? We were talking earlier, you mentioned the state's been kind of watching and giving feedback. Can you kind of talk about what's been going on?
Yeah, so we work very closely with Washington State Healthcare Authority. We also work with Department of Social Health Services and the Governor's Office. And so they have been working very closely with us. We were in the beginning almost meeting weekly, and then they were down here regularly meeting with us. They work very closely with our behavioral health providers, and then we actually had some say in kind of how the contract was developed, and we actually, some of the county staff participated in the selections of the health plans, so we were involved from the beginning in detail, and so we have very good relationships with them, and we appreciate that because they really listened to what we had to say.
Because I would assume, in theory, some things you think would work great, but they didn't work out so well, and so you're able to change those things.
Absolutely, absolutely, and that's why they set up these regular calls between the providers, the health plans, the counties, and the state to talk through those issues and talk about, okay, what do we need to do to kind of address those particular challenges and work through them. And we appreciate that because they were very responsive.
Okay, so let's talk about some of the early challenges since April.
Yes.
How's it been going?
Fairly well, I would say it's gone well. The system did not crash. I think a lot of people were concerned because this was such a big change for how Washington State delivers Medicaid. For the average person receiving the care, they did not receive a disruption in service. But what I would say, the biggest change was for the behavioral health providers. And so, we focused a lot on making sure they got paid and that they could submit their data. So that was probably where the biggest challenges were, was helping them adjust from a couple of different systems over to this one system and working with the health plan. And then also helping to educate the health plans about how our systems worked in this community, making sure they knew who the providers were, and then also just helping them to educate, making sure they completely understood like the chemical dependency system and connect to the criminal justice system and the housing providers. So, just a lot of work had to be done in a very short amount of time. So as you can manage, challenges were there, but this community really came together and worked through a lot of that.
And for the individual, you said that they haven't really experienced any difference, but this is just kind of the beginning.
The beginning.
And so they're starting to see how this will better integrate their services?
Yeah, so one of the things that needs to happen next is that the health plans, we have two health plans, Community Health Plan of Washington and Molina Healthcare Washington. And basically what they have to do is submit a plan for clinical integration. And so that basically is actually changing how the care is delivered. So we went through the first hurdle of actually integrating the finances. Now we're talking about integrating clinical care. And so now they're starting to work, they're part of a couple community collaboratives down here where they're starting to work through some of those, what does those new models look like, and how do you work with the primary care providers and behavioral health providers.
Okay. Can you give any examples of any new services that could be either have been created or will be created with this change?
Yes, absolutely. So, one of the things that we have tried to do in Clark County was look beyond just medical and healthcare services. So some new exciting things have happened. So one of them is that we work very closely with the homeless population, and we have a huge amount of people that have behavioral health and drug and alcohol issues. So we're looking at a couple projects. One is we have Lincoln Place, which is a housing first model. We're looking at how can we jointly fund to have a behavioral health specialist co-located there 7 days a week, in the late hours. So looking at from 7 p.m. to 2 a.m. And so that way you don't have to call the police or crisis services, which are expensive. And they can help de-escalate situations, help the people connect to services, and work with the staff there. So that's a new model, and that's something we're trying, and we hope to have that going in a couple months. Another one is we're working with the Housing Authority to think about are they willing to kind of look at building some housing for this particular population with behavioral health issues and have providers there co-located to actually engage people, make sure that they're in treatment, but also make sure that they have housing, so that they can meet the basic needs. And so that's another model that we're kind of looking at. So trying to make sure as we're trying to integrate care between primary care and medical, we also provide some housing for them. And then we're also looking at a legislative proposal to create a standalone coordinated center, and it's for crisis triage, stabilization, and treatment. So basically, it's a one-stop place where families, law enforcement, providers can send people who have a behavioral health crisis who actually can get triaged and sent to the right services. There'll be some crisis stabilization beds there to kind of help them so they don't have to go into inpatient. We're looking at an evaluation treatment center there so that you can actually have them detained there and stay in our community. We're looking at more of detox facilities so that we can actually build capacity in our community. So, our goal is to put that forth this session and work with all of our partners to include the health plans to actually build that center here so that we can actually have those robust behavioral health services in our community, because we don't have that right now. It's lacking. We only have 3 crisis stabilization beds, and we do have a detox.
3?
3, that's all we have.
Oh my.
And we have a 11-bed evaluation and treatment center. We want to do a 16-bed. And then we also have a detox 16-bed, but it's always full. So as you can imagine, we're constantly sending people out of the region, or they're going to Western State Hospital, which again, very costly.
Right, and that's the end game, right?
Yes.
To reduce those costs, because putting someone in jail because they're drunk
Yes.
is extremely expensive and ineffective.
That's right. And I would say law enforcement have been wanting this crisis triage center for a long time. And so they're part of the planning, and they're very pleased that we are kind of moving in that direction now.
That's exciting. So what are some of the next steps in this process?
So, the next steps is to continue to work with the health plans and help them, develop that clinical integration plan, and then work with the providers to provide some technical assistance to kind of move them in that direction. And the state actually has a couple of different programs to help do that. Then we're also going to be, moving forward with some other projects with housing, but also, hopefully getting this crisis triage stabilization center actually be funded so we can actually move forward and build that. And then I think, our next step is to kind of how do we start focusing on, once we get the clinical integration going, start looking at more preventative kind of measures and more upstream kind of measures so that we don't wait till people get in crisis. So it's a phased-in process. We've got a ways to go. We've got other systems we need to include, but it's a step in the right direction.
Good, good. So if people want to find out more about the Medicaid resources in the state, where can they check?
I would say the best place to go is the Healthcare Authority's website, and that's www.hca.wa.gov. And they have a variety of eligibility for the Medicaid programs. They talk about the early adopter regions. They have their Healthier Washington initiative. So they have a lot of information on that website.
Great. Well, thank you very much for meeting us.
Thank you.
And we'll check in as this progresses.
Thank you. I appreciate it.